Just about everyone feels nauseated every now and then. Whether it's food poisoning or a stomach bug, we'll do anything to stop that queasy sensation. Unfortunately, a lot of the time, vomiting is the only path to feeling better. But imagine throwing up every 10 minutes for days on end. For Molly, this nightmare started as a baby. It wasn't until a decade later that a doctor recognized her symptoms and gave her mother a diagnosis of cyclic vomiting syndrome, a disease that's relatively unknown, difficult to treat, and severely impacts quality of life.
This would happen every 6 to 8 weeks. She would start vomiting then once we got her tucked back in bed, and start about every 5 to 10 minutes she would have a vomit. And then she may do that for an hour or so and then rest for maybe an hour or so, and then wake up and would start the vomiting again. Her length of an episode was 2.5 days generally, sometimes 3.
That's Kathleen Adams, Molly's mother, and the founder, president, and research liaison of the Cyclic Vomiting Syndrome Association.
Dizziness, intense nausea, thirst. Molly did not have headaches or belly aches, but some people with CVS do, so they're plagued with pain and nausea and vomiting. And that would turn on like a light switch first thing in the morning, kaboom. And after she was finished, it would turn off like a light switch, and she would be ready for her most frequent request was a little cheeseburger.
For 11 years, Kathleen could not solve the mystery behind her daughter's continuous vomiting. But after finally finding a doctor who knew what was happening, Molly started to improve.
He was able to medicate her with the most commonly used medication still to this day for cyclic vomiting syndrome, which is amitriptyline, or Elavil as it's known to the public, an old antidepressant which is also used for chronic pain and migraine. So Molly, within a few months, started getting less episodes, less intense, and gradually, over the next 5 years or so into adolescence, the episodes got much, much better, and they evolved then into a migraine headache, which this is kind of a common textbook picture of the disease that Molly has.
Today, Kathleen is devoted to spreading the word about cyclic vomiting syndrome. Dr. B. Lee is a professor of pediatrics and the director of the Cyclic Vomiting Program at the Medical College of Wisconsin.
It essentially are recurrent spells of vomiting, and they're usually very severe, and they cause a child or adult the inability to walk or talk even, so they are completely out of it. They vomit to the point of dehydration, end up in emergency rooms, and very much look like they had the worst case of food poisoning or stomach flu, except that it keeps happening over and over and over again. So 10 times in a year would not be atypical for this.
While some people may underestimate the disease, Lee argues that it's no joke.
These go on at least several hours. Our average is 24 to 48 hours, and we have some outliers at about 10 days. So it can be very prolonged, but it usually will stop on its own eventually. And there are even some kids that vomit more than 400 times per episode.
Researchers say episodes can be triggered by stress, lack of sleep, prolonged fasting, even by an exciting event. For patients and caretakers, learning about and avoiding common triggers can make CVS more manageable. However, Lee says many people suffer for too long because the medical community is largely unaware of the condition. He says that patients are repeatedly misdiagnosed and not taken seriously by doctors.
We still encounter children who, for example, have not been properly diagnosed for 10 years, and they've been going through this in and out of emergency rooms for 10 years with other kinds of diagnoses, psychiatric, recurrent stomach flu, etc. And more often it's, well, I think it's in your head.
While CVS is certainly a very real disorder, it's correct that the origins appear to be neurological. Lee says family history shows a pattern that is key to figuring out what causes the syndrome.
About 80% of the children have somebody or themselves, but usually somebody else in the family that has migraine headaches. There are also, when we mine the family tree further, there tend to be members with a number of other things, including anxiety, depression. They have a disorder called postural orthostatic tachycardia syndrome, where they get faint, lightheaded when they stand up quickly. They can have sleep disorders, irritable bowel syndrome. So when you look at the family trees, you find a lot of other what we call functional disorders.
Treatments for the syndrome exist, but once the vomiting starts, little can be done except to head to the hospital. There, IV fluids help with dehydration, while anti-nausea meds and sedation slow down the vomiting. To avoid the hospital stay, preventive drugs help to reduce the rate of episodes.
In little children, we use something called cyproheptadine, and that's used for many different conditions. It has some anti-allergic properties, but it's also used for different vomiting disorders. It tends to help as a prophylactic in young children. In older children, we use amitriptyline, but there's also anti-seizures drugs that may work for this disorder.
That's Dr. Katya Kovacic, a pediatric gastroenterologist at the Children's Hospital of Wisconsin. She says most children eventually outgrow cyclic vomiting by adolescence, as it often transforms into migraine headaches. For the small number of adults with CVS, the syndrome is more severe. Anxiety disorders affect about half of all people with CVS, and a lack of stamina, dizziness, sleep disorders, and limb pain are also common.
Even when they're well, they are not quite well. They are still afflicted, especially, for example, with limited stamina. So exercise, they can't keep up with their peers is the basic challenge that they face. So they face other challenges that we didn't recognize before, and we have done studies on what we call quality of life, and they are as bad as anybody with Crohn's disease or what we would consider organic gastrointestinal disease.
Cyclic vomiting syndrome can be managed, but it's traumatic to live with and care for. Thankfully, it's rare. For the vast majority of us, feeling nauseated is simply a product of something we ate. You can find out more about the Cyclic Vomiting Syndrome Association at cvsaonline.org or through a link on our webpage, radiohealthjournal.net. Our writer this week is Amira Zaveri. Our production directors are Sean Waldron and Nick Hofstra. I'm Nancy Benson.
Get your Plenty card at Exxon or Mobil and start earning points at lots of places.
So I get points for filling up at Exxon?
You sure do.
What about getting coffee at Mobil?
Points.
Streaming TV shows on Hulu?
Definitely.
Points on my AT&T wireless bill?
Yep.
Buying soap?
At Rite Aid.
Buying you a birthday present?
Points at Macy's.
Visiting your parents?
No. You get marriage points.
Oh.
Exxon and Mobil are the only fuel brands that are part of Plenty, the rewards program that lets you earn points at one place and use them at another. Join Plenty for free through a participating Exxon or Mobil station today. Terms and limitations apply. See plenty.com/partners for details.
They say life is about choices. So let me introduce you to one of the best choices you can make in life, Grainger Choice. The Grainger Choice product line has just about everything we need to keep this place running, from batteries to V-belts, safety to sump pumps. And with Grainger Choice, we can trust that every product is dependable and cost-effective. When it comes to making life choices, here's a great one. Grainger Choice. Get it? Got it? Good. Call, click Grainger.com/choice or stop by. Grainger, for the ones who get it done.
Flu season starts with all kinds of symptoms. At Walmart, we can help you be prepared before they show up with products like Mucinex to help relieve chest congestion and Delsum to help silence coughs for 12 hours. You'll also want to be ready with Sudafed PE to relieve sinus congestion and pressure, and Motrin for body aches and to reduce fever. So don't wait until the symptoms have already started. Be prepared for flu season this year. Stock up on everything you need at Walmart.
Use all products as directed.